Well, which way Nigeria's health ecosystem? The song says a single step is the beginning of 1,000 miles. And so one respectable action that is positive in a health system can change an entire thing. So my name is Tiluchen Nasser, and of course I'm still your anchor. And today's conversation actually is one that touches every Nigerian, rich or poor, young or old, because we all need healthcare at one point or the other. And like we say, we're all managing one sickness or the other in this country. Nobody's totally healthy. We're just managing. And so today we ask a very important question. Can Nigeria's hospital culture change? Must it remain the old habit of no drugs, doctors talking down on patients, nurses being harsh? What can be done? Can our healthcare systems move from complaints, fear, and frustration to compassion, empathy, accountability, respect? And of course, you hear about centers of excellence, medical centers of excellence. You go, they tell you about Johns Hopkins University, they tell you about several other universities, where you have excellent healthcare system. So our focus this morning is on an initiative boldly championing this change. The change from the old ways we are doing things to something new. So Quantus Medical Foundation and WeCare Nigeria initiative. Of course, this initiative is pushing for a healthcare culture where patients are treated with dignity, with honor. Medical professionals show empathy. Hospitals are accountable, and excellence becomes standard, not an exception. So, who do we have to help us talk about this? This is a conversation. So, joining us is a woman at the forefront of this. I recall the era of Bianca. There was this joke about Shina Peters, who said this not because of Ikemba, he would have piam. This is not because of Ikemba. So we have a delectable lady. Her heart is as good as she's beautiful. She's actually a medical professional, healthcare advocate, and reformer. She's the founder and CEO of Quantus Medical Foundation and the lead of the WeCare Nigeria initiative. Please, friends, listeners, viewers, join me to welcome Dr. Nenna Ihekoromado. Good morning.
Good morning. Thank you so much for that warm introduction. I really appreciate it.
Yes, I would like to start from the beginning, from the basics. Who is Nenna Ihekoromado? Doctor.
I'm glad you asked.
Is it a PhD or an MD?
So I'm first a mother, a sister, and a daughter. A physician by training. I do clinical research, biotech, and pharmaceutical clinical research. I'm US based, Dallas, Texas specifically. But God has put this mission in my heart. So I'm also a healthcare transformer. And I started the Quantus Medical Foundation, and I'm the lead for the WeCare Nigeria initiative, fully focused on this mission in Nigeria to help restore the healthcare systems in Nigeria and bring back compassionate care, dignity, like you said, to the healthcare system.
Yes, at a time when a lot of Nigerians who have managed to transit to better climes are scared of coming home, even for a visit. You are here driving an initiative. So what is the compelling, or what are the compelling factors why you choose to do what you are doing?
The truth is simple. The healthcare system in Nigeria, our Nigeria, regardless of where you live in this world. If you're Nigerian, if you were born Nigerian, you must agree that the healthcare system is broken, that change needs to take effect and it needs to happen now. I'm actually wearing red and red because I feel like the healthcare system is bleeding. Our medical professionals in Nigeria need help. They need training, they need support, they need to be paid because they are leaving. There's a mass exodus of medical professionals out of the country. So we need to stop the bleed. And that's why this conversation today is extremely helpful. We need to make everyone aware of the crisis. As a good friend of mine said yesterday, it's a tsunami. We cannot ignore this. So I'm happy to be here. Thank you.
Okay, there's something common with Nigerian hospitals. And so many Nigerians complain very bitterly about poor treatment in hospitals. It's like a habit. They talk about long waiting hours. I also know that in some civilized climes, for you to see a doctor, you also have to wait. But in our kind of waiting, it's not just that. You have to book an appointment, to see a doctor. Harsh communication. I keep on saying that most health professionals need to undergo health communication. I've experienced one where you see a doctor telling relatives of a patient that is dying in a manner that they would even have died even before the patient dies. Lack of empathy, like we said, and sometimes outright negligence. This is very, very common. A lot of people can relate with negligence. So from your experience, what are the root causes of this culture in our healthcare system? Is it that our doctors, our managers of our hospitals are not properly trained to show empathy, to respect the dignity of patients, and even to uphold excellence?
So it's multifactorial based on what we've learned. We conducted a structured staff satisfaction survey in the pilot hospital where we're working, UNTH, through this flagship initiative. And the outcome of this survey revealed that within the hospital system, the medical professionals are unsatisfied. There's heavy burnout. They are poorly paid. They are not fully respected. And yet, their attitude is they still want to work in the hospital, especially this particular hospital, UNTH. There's a tremendous love for the job. However, they need help. The government needs to support the healthcare system. The federal government, for sure, needs to do something to support these hospitals because with the staff leaving due to the poor conditions, poor resources, poor equipment, poor working conditions, it's everything from the toilets to the nurse's room, no internet, it's even there's poor training. We need to help the medical professionals. Governance is critical. We need governance that works, not just leadership by name, but leadership that actually sets standards. And it needs to happen one hospital at a time, one state at a time. We need to monitor compliance. We need to support the entire healthcare workforce and correct this systemic failure that has plagued the entire country. Culture change is impossible without governance. So I say governance is number one, and it's on all levels. So what we are building through this initiative is a chain: leadership standards, staff training and retraining, supporting patient flow systems. So when Mr. Okonkwo arrives in the emergency room in a tertiary hospital, they are not treated like a nobody. They're treated like a human being. The relatives are listened to and not yelled at. They don't wait forever. Then they're not allowed to bleed out. So there's many reasons why the current status quo cannot continue to stay the way it is. We need to change.
We need to change, and of course, there are many reasons why the status quo must continue the way it is. Doc, I may be wrong. I learned that since you came into Nigeria, into Enugu State, you've had one or two outreaches, be them seminar, be them conferences, be them talk shows. So where have you been? I learned there was a particular event you had at the UNT.
Yes.
So what was that?
Yes.
And can you share your experience?
So what we're doing in UNTH actually started in October with the incredible support of the CMD UNTH, Professor Obina Onodugo, who actually is my classmate. I went to medical school in UNTH, so I have a different type of love for this hospital. So what we're doing in UNTH is very practical. So we didn't come with noise, we came with structure. So we've been working with leadership, training the staff, and building a culture where patients are treated with dignity and emergency care is taken seriously every single time. Every shift, we're training the nurses, the doctors, even the porters to own their shift. Treat patients with dignity, bring compassion every day to work. Compassion is not a soft skill, it's clinical. When you look at your patient, eyeball to eyeball, understand their pain, know they're terrified because it's Nigeria after all. So we're training these medical professionals in Nigeria, which in UNTH. Again, UNTH is a pilot location, and what excites me the most is that the staff in UNTH embraced this change. It actually brought tears to my eyes at the end of a 2-day change management leadership forum in UNTH, where we pulled in the executives of the hospital, of course, led by the CMD, the CMAC, the deputy CMAC, and all the leaders, about 25 of the leaders, and then change ambassadors. We brought together change ambassadors who are heads of departments of the hospital, the people that actually lead different departments. So we had a room of over 120 UNTH people, and we rolled out compassionate care training. We talked about our baseline survey of the hospital, which we came in November, surveyed the hospital, did a tour of the accident and emergency, conducted this structured staff survey I talked about, where we got 443 responses. And then we also provided our recommendations to the hospital, and they received our recommendations entirely. So some of the recommendations were simple. Governance. We need to bring back true governance. The hospital already has a policy of not asking patients for funds within the first 24 hours. They don't make it mandatory in UNTH, the first 24 hours. However, patients still tend to be turned back in emergency situations for other reasons. It's either the beds are not available, or the doctor is not available, or there's many other reasons. And again, it's not specific to UNTH, but we started with this hospital because they're ready now. And I believe the rest of the state is ready. The rest of the country is ready for that matter.
Well, I'm glad to hear this. And I'm sure a lot of our listeners and those who are watching us online will also be glad to hear this. I'm concerned about one thing. Nigerians or Nigeria will never been bereft of this kind of conversations, this kind of training, this kind of intervention. Yes, you come and do that and embrace it. Then you go. And it's back to square one. With due respect to my friend Professor Nadugo, UNT has a reputation. That's just the truth. They have a reputation. Somebody will tell you if you want to bring your relative worse than he was, then go to UNTH. The issue of emergency ward, the issue of turning people back, even when the person is on. There are several cases. We don't rehearse them there. But I'm concerned about monitoring and evaluation. You started a good work. So now, if you, after spending your quality time here and decide to go back to where you're based, monitoring and evaluation, how do you ensure that these lofty ideas, these measures you brought, that there's a continuity long after, or is it just optics? Oh, take pictures with you. They say there was a defender that was here, one of us before. She came back to give back to the alma mater and all that. After the collect light, what happens? How will you trace? How will you monitor and evaluate the ongoing? That what you just done is continuous.
It's a brilliant question. Sustainability is key. And people have spoken poorly about UNTH over the years. The focus is not about yesterday, the focus is about today and tomorrow. Moving forward, what we're doing in UNTH is real. The change is palpable. And I urge the community to give UNTH some time, because the new UNTH that's about to surface is a different face. The people have felt this change. They have spoken and they are ready to act. There's multiple policy reforms going on in UNTH today, and it's from the top all the way to the bottom. See, when you effect change and you get to the level where you're working with the porters that carry these patients and you give them a platform to speak out, to speak up, talk about their challenges. Why is a porter finding it difficult to move a patient from location A to B? And we actually hear them out in front of the leadership and then correct some of those ways. That's true change. And that's what we've done with the entire staff that work at the Accidents and Emergency in UNTH. So change is coming. Change is here now in UNTH. The new UNTH is already available to every Enugu resident who wants to try it out. But culture change takes time. I'm sure you must acknowledge that.
Yeah.
So there's a lot that needs to be done still. But it's little things like not having internet in the emergency room, for example. So we've installed Starlink, because how are you going to talk to them about improving the workflows, about electronic medical records, about digitizing workflows without internet? They do have intranet, but you need internet to be more efficient. So our focus through the WeCare Nigeria initiative is not just compassionate care, it's accountability, it's respect, it's excellence, efficiency. So we're making the accident and emergency encounter for every patient through this initiative as efficient as possible, so that when patients go in there, they feel seen, they feel heard, and they are taken care of. So another way we've tried to ensure that this is sustained is by recommending our own WeCare Nigeria staff to stay back in UNTH. And Professor Onodugo didn't just embrace this, he asked for it, he begged for it. So we're leaving 3 of our staff back to keep an eye, to hold the staff accountable, to support the compassionate care that we're pushing. These are our staff that are fully trained to know how to liaise between patients and the hospital, between patients and us, so that everything we're pushing is real and it's actually happening.
Well, this is just very heartwarming to know that when you're done, you are not just packing your bag and baggage and then disappear. There are 1 or 2 professionals who will stay back and do the M&E. Yes, there are a lot of issues. And some healthcare workers, professionals, argue they're overworked. Poor remuneration, inadequate facilities affect their attitude. And as I just pointed out, there was this issue of lack of internet. I hope they will not, when it had disappeared, they won't prioritize it, who should use it and who should not use it. Now, lack of consultants. You see, if you've been to UNTH, it's good enough we are doing this. They're conscientizing the workers for need for them to be accountable, for them to show empathy, for them to respect the dignity of patients. But you know, there's one recurring decimal in UNTH, not just UNTH, most government hospitals. The consultants are never there. You could be in a hospital, be admitted, and for 4 days they tell you the consultant is going to come and they will never be there. And well, who do you find? You find student doctors and house job guys, you know, managing the patients, and nobody talks because the consultants are like the big guys.
Right.
So you can't just order them about.
That's right.
And then the doctor-patient ratio is not related to UNT, but you know it's a grossly poor because of the Japa syndrome. Most health workers are poorly paid and they can't stay. So with this in mind, how can your organization go further to ensure that those who are paid, like the consultants,
Yes.
stay around?
You
It's a big
know,
one.
it's a big one. This is a massive one. It's at the heart of them, and it's multiple folds because if you really think about it, there's a reason the consultants are not fully present in the hospital. So let's speak about that. The remuneration is so poor that the average consultant could not possibly make ends meet if they worked full time in the hospital as they're supposed to. Let's just call it what it is. Therefore, they have private hospitals. The problem is that culture has invaded the system to the point that they're no longer available where they're actually supposed to be. Therefore, we're helping support this by first focusing on governance reform in the hospital. So, part of the recommendation that we shared with the UNTH leadership, which again they fully embraced, is this governance. So, with regards to the consultants, we recommended that every single consultant that's paid to work in UNTH will make themselves available fully 2 days a week, 2 full days a week, 9 to 5 p.m. with a 1 hour break. And in addition, make themselves available 1 day a week virtually. Now, it's now on UNTH leadership to work the shifts so that we don't have all the consultants showing up one particular day. That way it's spread out, but we need to make available the consultants in person as they should be. But it cannot be every single day. It's not realistic considering the pay limitations that we talked about. Now, with that said, if this doesn't happen, the issues that we've been talking about continue to get worse. These residents, house officers, or you call them junior doctors. I don't think there's any junior doctor. I think every doctor is senior. These doctors need to learn from the consultants. So if the consultants are not available, how are they going to learn? So I'm pleading and I'm calling on consultants of UNTH and every other teaching or tertiary hospital in the country. The time is now. The current status quo cannot hold. You need to make yourself available. There's a reason. Tap into your inner self and think about what's at stake at the moment. Again, I call it the red zone. This is code red, if there's anything like that, because we need to turn this around. If we don't, we will get to a point, God forbid, when patients show up and you don't know who can be a patient tomorrow. Could be you. Patients show up to a hospital and there's no one, literally no one to care for them. No doctors, no nurses. So the time is now. Let us change this. Let us turn this around. Make yourselves available. But with that said, I have to also speak honestly about remuneration. Many healthcare workers are exhausted and fully underpaid. You know, The average doctor in UNTH makes anywhere from $300 to $600. Now let's compare that with what the average doctor is paid in other countries. No, I couldn't compare. There's no basis for comparison. However, these doctors in Nigeria work their butts off. They are there. They are bright, they're smart. I went to school here. So, how are you going to demand excellence from people who are struggling to survive? How are you going to demand excellence where fair remuneration is not available? And this is not luxury we're talking about. It's even part of patient safety. If you really want your patients to be safe, the people that care for them need to be available. They need to be able to do the job. So if we want doctors and nurses to stay, we must pay them properly. Simple. We must protect them. We must respect them. Because these are the people standing between life and death every single day. So that's the truth. So who are we talking to at this point? It's the government. It's the federal government. It's the organizations that support the healthcare system in this country. It's everybody. And it's even the patients. The people of Nigeria need to know their rights. They need to demand that care is given the right way. So if everyone is picking up, the media, like you, allowing this to happen, if everyone is picking up and speaking loudly, but at the same time acting actively, then this can turn around.
Okay, you speak with passion, you speak with commitment, you speak as if by the press of a button, all these anomalies would change. I'm going to bring you to attention another. But before I even do this, Doc, would you believe that a patient who needed an urgent care got into a hospital, not UNTH, and they said, "Oh, we'll get you a consultant. He's going to come." Doc, day one gone, consultant. Second day, no consultant. Third day, no consultant. The fifth day, 5 days gone, no consultant. And the nurses were just managing somebody on an emergency. I don't want to call out the hospital. It's real. It happened to somebody who's very close to me. And of course, when they came, they just gave one decision that the guy did not quite accept and abandoned him. They just left him. Say, if you don't want to do what we ask you to do, that 5 days, they were looking for the consultant. He was not there. But just to tell you how grave, how bad it is something they said, if you want to die very fast, go to one of these hospitals. But like you said, Nigerian public hospitals, they have the best trained medical doctors. It is the attitude, it is the care, it's compassion. Is the need to ensure that this oath you guys take, it is to save lives or whatever. They don't, I think they now want more money than that. But however, there's another one. When you've got the doctors, you've got the nurses that attend to patients, and of course the drugs, out of stock syndrome. Out of stock syndrome. And sometimes fake drugs. Are you averting your mind to this, that even when the doctor has done all that and right drug to discover they are not there in the hospital? And if you know where UNTH is, well, there are a few pharmacies there. You needed to go to maybe a town to get. Is the organization addressing the mind of issue of availability of essential drugs?
We are. The problems are way too many to address all at once.
Yes.
Let's keep it real. So our goal through the WeCare Nigeria initiative is to first touch the hearts of the people that do this work. Because all this time I've been in the United States, all I hear is doctors coming back to build yet another hospital. The government building yet another hospital. Medical city, an ultra modern, massive hospital, and yet the people that actually do the job are not available. They don't want to do it because the pay is so poor. they're not trained to do what they're supposed to do. So there's errors, gross, grave errors. So what we're doing this moment is focusing on how to get that culture to change first. But we're not ignoring every other issue. So, for example, like you mentioned, the pharmacy systems are making available drugs to be in stock. Well, most pharmacies are not digitalized. They're not digitized. So they don't have the software that tells you what drug is available and what drug is not. You're counting on the extremely underpaid pharmacist to then realize manually that a drug is available or not. So the issue is just nonstop, it's ongoing. So part of what we're doing is, like I said, first of all, making sure there's internet and then supporting the softwares that you need to ensure that stock is available. It's medicine, it's the right medications, but it's also supplies. Patients, when they go to the hospital, are told to buy their own gloves, buy their own syringes, they buy everything they need for their own surgery or for their own care. That is highly unacceptable because the patients that can't afford that, then what? It brings tears to my eyes to just know that there are patients that show up, and if they can't afford any of this, it's a death sentence. This is not the country I left. It was never like this then, and it should never continue to be like this. We have too many brilliant people in Nigeria and outside Nigeria, so the time again is now. It doesn't cost too much to support one hospital with the software, the pharmacy software, for them to be able to have what it takes. So someone can do that. One individual can pay for it. It's not even that much of a big deal. So I'm calling on people that are hearing, support us or support the hospitals directly. Again, the time is now because the bleed is real.
The bleed is real and the time is now. I'm not sure. I don't want to take you out of your comfort zone, but we're talking about UNTH, and UNTH caters for quote unquote mostly urban dwellers, so to speak. A few from rural areas once in a while got the UNTH, and so access again. Are you considering? Well, I don't think I want you to put all your fingers in one mouth at a time. But of course, when we have this kind of interventions, we want to think. Typical Igbo saying, "Ili energy, ikbayanko," you know, "Ili energy, ikbayanko," because you don't climb that once every day. How can, just an advice, how can governments in Nigeria ensure that those who live in my village have access to quality healthcare? Or we advise the government on how that could be done?
That's brilliant question. Because those who are in the villages, the rural areas, yes, you're right. They truly do not have a loud voice, but we can help them. So, first of all, government needs to take a good look at the primary health care centers in these different local government areas. You know, when we talk about culture change, we could actually consider this culture change starting from those primary healthcare centers. We're working through Quantus Medical Foundation, this WeCare initiative. We are working with the Abia State government, and they, championed by the Honorable Commissioner for Health, Abia State, embraced the bottom-up approach. This approach, he asked and begged that we implement in the state, involves those primary healthcare centers that you know the states have been building. You keep hearing about we're commissioning another primary care healthcare center.
Go there, my sister.
That's right. So Abia State understands the need to train these midwives, nurses, that work in the and train them not just on compassionate care, on patient dignity, but how to even work in a new facility like that. So that's part of what we're doing to support the primary health care. Just creating the awareness so that villagers, like you said, first of all, understand what preventive health means. And they get to know this by going to the primary healthcare centers where they truly will get help. Honestly, the people don't trust the healthcare system. The healthcare system has been broken for so long that the average villager wouldn't even go to the hospital or to the primary healthcare center when they need to. They wait till it's too late. So, continuous talk about this. We need to get the people to start to trust the system, which is part of the reason the healthcare scheme, the health insurance scheme, that is, doesn't seem to be working. Again, the people don't trust the systems. So if we can bridge the gap where the average villager or anyone even in the township trust that when they walk into a healthcare facility, it's not a death sentence, you're going to start to see things change. People will subscribe to the health insurance scheme. People would embrace the care, that's given to them, because that care is now different. It comes with compassion. It comes with accountability. It comes with respect, and it is excellent care. That's what we're training the doctors, the nurses, the medical staff, the allied medical, who, by the way, are permanently on strike. The strikes are killing people in the country. But the strikes are valid, I must say. But it's time for us to all embrace the need for everyone to circle back and think about what is the effect of the strike on the people, one. And if they don't strike, what is the effect of the status quo that's making people leave, these doctors leave? So it goes both ways.
I agree with you. It goes both ways. Well, there's something that I won't say is psychological, or maybe psychological. Every patient who goes to a hospital has some expectations. When you go, you meet a doctor, he treats you, you get the drugs and all that. It's an expectation. But of course, you know that if wishes were horses, beggars would have been millionaires. Most times when they go there, unmet expectations of patients are the root of disillusionment and the inability to believe that even government hospital can take care of them. And my question would be, is there any way WeCare Nigeria initiative can help balance patients' expectations with the real challenges faced by medical professionals? But there are real challenges they have. No matter what is the patient's expectation, they can never meet that because they are facing some real challenges.
I think the patients know. I think the people know. The people,
Very few people know.
The people know the challenges the doctors, the nurses are all going through, but that's no excuse for us not to demand care from the people.
For instance, you come to the hospital and suddenly for 5 hours there's no electricity, there's no power.
Yes. But you see, that's my point, right? The people know that it's not
the tap is not running.
In the hands.
The tap is not running.
But that it's not the doctor's fault.
I know.
It's not the nurse's fault. Whose fault is it? It's the people that we are trusting to take care of us. It's the government.
Government gets a CMD. Government gets people a board that managing the hospital.
That's right.
So it's not the government. It's the managers of the hospital that the people are expecting that certain basic things must be there.
That's right. It's every level.
Yeah.
If the government does not give enough to the people they've put in place to govern, there's a problem. If the people they've put in place to govern, the leaders, are not demanding hard enough, loud enough, or when they are given, it's used in different other ways, then that's the problem. Everyone needs to see that if we don't turn this around, and that's every level, it affects every single one of us, including the government, because anyone in the government can get sick, and there's not going to be enough time to fly them out of the country. they will end up perhaps in one of these hospitals. And then what? So everyone needs to sit up and focus on why we need to turn this around. And I'm pleading to the government. I'm pleading with the government. I'm asking that please consider taking a good look at what is going on in our hospitals. It takes one who gets off their high horse to come down and see firsthand, like we've done, what is wrong. These people need support. These doctors truly need to be respected. They need to be paid well. They need to be trained and retrained. It's not enough to just demand from them. You can only give what you have to give. But if you're running on empty as a medical professional in Nigeria, what can you do? You can show up, but if there's no resources to work with, if everything around you is messed up and broken, then, like you said, if there's no light, there's no running water. You know, part of what we did was Change Management Leadership Forum. Part of my team in the US are US doctors, Caucasians, American Indians, American African Americans, part of the foundation. And they truly took the time to listen to the issues we're having in the Nigerian healthcare system. So one of the issues was during one of the forums, one of the nurses clearly explained to a white doctor who is part of our foundation that during surgery, the power goes out. So my colleague couldn't understand as a doctor. So the entire conversation became about, so what did you do? And the nurse said, oh, we just continued.
You didn't touch.
We just,
Or using food.
You know, we just continued because, and that traumatized her, my colleague, fully traumatized. And she has pulled more people into the foundation to work on this initiative than you can ever imagine because they truly care. So if people that are not even Nigerians, don't even look like us, want to help, I'm calling on true Nigerians that live here and live outside Nigeria that have the ability to help. You can lend a voice. You can bring your time. You can train. You have enough technical knowledge to provide training. We will do all the coordinating. You just need to show up, provide funds, own some initiative, part of what we're doing. You can support by providing drugs for 1 month. You can support by paying extra heads that the government won't pay for now. Support comes in different ways.
Support comes in different ways. And before we go on a short break, Doc, I want to bring in the issue of accountability in various forms. One of the biggest challenges we face in this country, and the hospitals are not an exception, is accountability. It comes one, how do you manage the resources given to you? How do you manage the facilities available to you? How do you ensure a maintenance culture that the things you have, that's sometimes you come to government hospitals, you look around, you may not be able to sit down. But how do you account for the furniture that's given to you? Now, how do you let people know? Part of accountability is communication.
Yeah.
How do you let people know that, look, these are our challenges, but these are our plans to do what? To overcome them. Importantly, is about fund management. I'm sure it may not be an area of intervention, but it speaks volumes. It speaks volume of our people. I'm a journalist, and I pride myself sometimes about investigative journalism. It's just that this part of the country can't do that very well. Otherwise, you'll be looking for my cup somewhere.
Oh, wow.
So we hear a lot. We get to see a lot. That even when they say they don't have no funds, the funds are being mismanaged, misused, used for other things. So accountability is is the issue. So how can hospitals and healthcare providers be held accountable without discouraging or demonizing them?
Yes. You know what you've just done? That's the big elephant in the room. Yeah. Funds management, right? And we know it has to be talked about because it's at the heart of what is wrong. But, for us, accountability simply means that everyone does what they are supposed to do on time with professionalism, and that patients can trust the system will respond when it matters most for them to respond. Therefore, for us, accountability is not about punishment. So I hate to go back. I focus on moving forward. And moving forward, I plead with every single stakeholder to hold themselves accountable. Culture is what you do when nobody is watching. So when you're responsible for funds that saves lives, when you're responsible for an institution, we have to put the right people that are trustworthy, people that are professional, people that are true to themselves. We need to put these people in place as leaders. And I believe they're there. I believe that. However, we need to find ways to hold these people, our leaders, accountable. This is not about punishment. This is about going over the actual issues one by one and making sure that if it's KPIs, we monitor KPIs. If it's action steps, we monitor those action steps. If it's budgets, we monitor the budgets. But leaders also have to be transparent in what they do. Transparency is lacking. So if we don't have transparency, how can we have accountability? If we don't have dignity, how can we have accountability? If the leaders lose respect, how can they be held accountable? Or how can they hold themselves accountable? So it's all fully encompassing. And again, we are calling on every single level. The agencies, Nigerian Medical Association, Nigerian Medical and Dental Council, the federal government, the Ministry of Health, everyone needs to be fully involved. I hear about multiple meetings. They put together boards to this. We can't keep talking about it. Let us just do. The action is what we need to see. The people need to see action. No more meetings. There's no point meeting and putting delegates and delegates and delegates. And at the end of the day, nothing is done. So it requires the Minister of Health showing up unannounced in one hospital one day and seeing firsthand what's going on, and then asking the questions: which consultants is responsible for this department? Where are they? When did they show up last? When things like that happen, people wake up and things start to get done.
Well, I'm not sure how long you left this country, but the issue is from the tone, from what you said, it would appear you left this country when Nigeria was still very, very, very good. Where UNTH was a center of excellence, University of Ibadan, where the likes of the kings of Saudi Arabia could come to Nigeria for medical checks and all that. Hassan Kuka, a bishop of the Catholic Church of Sokoto Diocese, had said once that Nigeria had made progress in reverse gear. And so you train in UNTH. Of course, if you relate to what you had when you were training and now, you see that there's a kind of deterioration in functions, in management of what it was then. Because 30 years ago, I had my first son at the UNTH. And there's a particular man, I think he's top in the management now, one which he was a house doctor. My God. That was the old site of the UNTH. You could literally see them working 2-4-7. There was commitment, there was passion. They stay this long working hours, and they're up there. And then they could even help you. I remember one particular when my father had to do a surgery, and we couldn't really locate the material we asked to buy. One guy came to us and said, look, no, your father will not die. And said they have a central store. I don't know whether it's like they are safe, where certain things that are not available can be found. He went there and got those things we could not get. Compassion, feeling for the next person, empathy. And that saved my life from my father. 1985. And okay, so that was the UNTH. There was a UNTH, and there's the UNTH, and other hospitals. So thank you for what you've been doing. Thank you for your intervention. Like you just appealed. Our other brothers in diaspora, wealthy Nigerians, even those who had passed through UNTH, what are they doing? If many of them are joining you to bring this kind of interventions, I'm sure it's not done later. UNTH will go back to its foremost position as a center of excellence. So we'll just take a short break, Doc. When we will come back, we'll continue this conversation. And for our listeners and those who are watching us, please don't go anywhere. Don't change the dial. We'll be back. And Dr. Nena will stay here.
Thank you.